morning. I'm going to do a posterior drainage, and so the first thing I'm going to do is check the patient's chart so I can see if the patient's going to be eating or if they have ate. If they have ate, then I got to wait an hour and a half after their meal to do a posterior drainage, especially with the percussion for them. So the first thing I'm going to do is always knock on the door, introduce myself, check the patient ID band, wash my hands, and then I'd apply the appropriate PPE. I can wear gloves. If I feel like the patient's gonna let out a lot of secretions, I can also wear something on my face, like a mask or something, just in case. So always before I do any treatments with anybody, I always need to check their vital signs. And so always, especially we're gonna percussion, I want to listen to the lung sounds. So I want to listen to see which lobes and which segments that the drainage needs to be drained out. And so then I would position the patient to where I want to. There's various positions that you can do. And one of the positions that you can do is elevate. You can have the patient elevated where their feet are up like this. So that way the feet are up. So this would be our patient here. Mr. Piggy here is going to be our patient, and I would have it raised up to where the feet are higher than the head. That way it can kind of drain out towards the opening. And so when you have the patient and when you're ready, so when you have them positioned properly, you never want to do the percussion on top of the clavicle or like the scapula. You don't want to do it below the ribs to where you can potentially harm any other organ that way. And if it's a female, you don't want to do it on top of the breast. You want to make sure it's underneath. That way you don't harm them or anything like that. You always want to check for any contradictions when doing the posterior drainage. If there's anything that can inflict your percussion with the patient, if they've had a broken rib on one side, you don't want to do it on a side where they have that. So then you would find another treatment that would work appropriate for them, especially with that. But when you go to do the percussion, you always want to do a cupping of your hand. You want to have a cupping, then you'll do a side wrist thing, and then you'd percuss on the patient like this. And then when your patient is ready, you would do it like as tolerable as the patient is. If they can do it within the 3 to 5 minutes of the procedure, that is better. That way we can continue the percuss, and then we will always give them a break, especially when doing percussion. But you can do a couple different areas if you have a couple different spots where you can where you know where the drainage is at. So you always want to face the patient. You never want to turn away from the patient, especially if you have somebody laying on their side. You never want to do that. You can also have a position, so the patient would have, so you can either have them where they're up like this, or you can have them down like this. You can have a pillow or something underneath their legs and something on their head like this and do percussion. You can have it to where they are laying on their side, having a pillow in between like that, and you can have it facing up like this for percussion, just depending on where the drainage is and what the patient is needing to be drained. And so then when you are when they're done with doing the percussion, you always want to position the patient to where they are sitting in an upright position to cough it up. You don't want them upside on their belly or their stomach or anything to try to cough that up, because that's going to be difficult for them and can potentially harm them. So you want to have them sitting up and have them cough. Do a nice deep cough to cough up any secretions that we percussed out of them. And then always have like a little basin or something that they can cough into. And then if the doctor needs a sample, we can always have a sample cup for the drainage. And then with the patient, we always need to make sure we chart down any of the coloration of the secretions, like if it has any distinct odor to the secretions that they coughed up, anything like that. We always want to make sure we chart down. And then we always want to make recommendations, especially for, sometimes this can be hard treatments to do for the patient to constantly percuss them. You can recommend doing patients like the PEP, like an acapella, or you can do an easy PAP for them in the future, so that way it'd be easier for the patient and you're not having to constantly reposition the patient all the time. And then you can do that, but this can work if you don't have those things available or anything like that. And then you would always reposition the patient when you're done, reassess the patient, listen to the lungs, see if it's helping, if the percussion is helping, if I'm getting the appropriate where I'm supposed to be doing. And then I would always wash my hands, remove anything, clean up anything. If there's any sputum samples, like make sure that gets to the lab if it needs to be. And then always chart on the patient's chart and let the doctor know that you did a posterior drainage exercise with them.